Thank you all for joining us today as we announce the largest coordinated healthcare fraud takedown in the history of the Department of Justice.
Business owner faces charges after investigators say she bought a Lamborghini and property and got plastic surgery while fraudulently receiving Medicaid benefits.
Diabolical.
Louisiana's Attorney General's office says Candace Taylor's businesses brought in more than $9 million in revenue during a nearly 5-year span. Investigators say at the same time, she underreported her income under a fake name. Agents arrested the 35-year-old yesterday and booked her with government benefits fraud.
Let's talk about Candace Taylor, also known as Candace Sailor. That's right. This young lady is a 35-year-old, very, very successful businesswoman coming out of Baton Rouge. That's right. This lady made well over $9 million last year alone with her businesses. Let me tell you something.
Sheesh.
Somebody explain to me why somebody with a business that's making well into the millions would go to jail yesterday for Medicaid fraud. That's right. She went to jail for Medicaid fraud. In 2019, they say she tried to get Medicaid benefits claiming that she was making $1,900 bi-weekly at her business. She was denied. 2020, she goes in again and claims again. She claims that she's making no money. Then she claims that she also has dependents now. So she lied. She says she has children and she's making no money. Now she gets approved for Medicaid.
See, the children she was talking about was lefty and righty, and then the other buns in the back. You understand what I'm saying? That was 4 children she's talking about. She had to claim those. You understand what I'm saying? But long story short, she's diabolical. I'm not knocking her hustle. To each his own. I wouldn't do that. Everything she's doing is a paper trail. That's why she got caught. You understand what I'm saying? But man, oh man, getting a BBL off of Medicaid, she cracked the code. How can you be mad at that? At the end of the day, they're doing scams themselves too. Everyone is scamming. Everybody's eating. You understand what I'm saying? It's just they're the fall guys. That's it. You think they're the only ones? There's people in high positions right now as we speaking with dirty fingers, dirty hands. But let's continue.
But you got to explain to me how somebody that gets approved for Medicaid not only is a millionaire, you're running a millionaire business, making good profit off this business. Not only that, you went and bought you a Lamborghini. Then you had the audacity to have plastic surgery done. Do you know all these records are attainable by, the authorities and all this stuff? Well, that's what she did. She took it upon herself to have plastic surgery done, to get a Lamborghini. I think the Lamborghini was worth well over $100,000. Plastic surgery was done. This lady also had over $450,000 or $480. I can't remember right now, but over $400,000 in a bank account. Can you imagine how these people are feeling to know that somebody like that got over on them? They got over on them. She got over them big time because she's got Medicaid benefits. A millionaire has got accepted for Medicaid benefits, and I know people that are struggling out here. They can't get a dime for Medicaid, Medicare, food stamps. They can't get nothing. You understand me? But this lady in Baton Rouge figured out how to crook the system. My question is Candace, if you're making $1 million and you can afford to drive around in a Lamborghini and also get plastic surgery, and then not only that, you had an Audi too, and you bought property, you're really wealthy. Why in the world would you take it upon yourself to try to fraud the government?
Physical therapy, $874. I literally had no physical therapy.
This right here is exactly how I got convicted for Medicaid fraud and then 22 months in federal prison. When I saw this video, I was like, this is exactly what happened to me or how it happened. A lot of times people think when I say that I went to prison for Medicaid fraud, they think that I had Medicaid fraud or was like getting Medicaid and doing something with it. I'm not quite sure, but it was actually what she's talking about. Ask yourself, when was the last time you went to the doctor and actually read your remittance advice that comes in the mail after you've been to the doctor? Now, this may differ if you are a person that pays for your insurance, but a lot of times people who do not pay for insurance, like individuals on Medicaid, They never really look at it because they know it's not a bill because they're getting free health care.
At the end of the day, the only people who can eat off of this is either a doctor, a nurse, someone who owns an actual practice, a facility, someone in a hospital. The patient, the only thing they can get out of this is just a service. There's no exchange. There's no money being placed in their hands. Everything is directly to, like I said, either the doctor, nurse, etc., whoever it is that's giving you the service. That's who's getting the cash. You're not getting any of that. But they're preying on your information and banking off of you so they can eat. And let's just say a lot of these places don't even exist. The address is fake. There's no equipment, but they're ordering stuff allegedly and they're billing them. Everything is an inside job. They probably got to connect with the place, or they, it's easy nowadays to falsify documents. So, hey, it's a lot of hustles out here, man. It's a lot of hustles, but they all ain't right. They all ain't right, baby.
And individuals like myself who at that time had permission to bill the insurance company on your behalf for the services that were provided can put extra billing codes or codes that you possibly never even received on your service and bill for it. And just as easy as you see with this hospital, and I'm not saying that's what they did, I'm just using this as an example, you can easily rack up $40,000 over a period of time in my sector of Medicaid claims.
That's crazy.
And that's what happened to us. Long story short, people always ask me how we got caught. It was someone who read their remittance advice and realized that their child had not received the services that the agency that I was working for billed Medicaid for. And this is so embarrassing to admit, but it's the truth. And if I'm going to tell the truth, tell the whole truth. Not only did the child not receive the services, for the time period that it was actually billed to the insurance, the child was deceased. What? Yeah, double whammy, real fucked up, right?
Super.
We passed that, but word to the wise, don't commit fraud, number one. Two, always check your remittance advice sheets that you get if you go to a hospital, a doctor office, or whatever on your insurance.
News that the feds had a national sting and they took down 324 people in a national healthcare fraud scheme. A lot of them were nurses. 2 nurses out there in Vegas made about $9 million. They were charging people for wound care supplies that they didn't need, getting kickbacks from Medicaid. Nurse in Connecticut, she was charging people $200 cash for visits to get scheduled 2 and 4 narcs. Nurse down there in Rochester was charging up people's debit cards. It seems that all of these nurses were approached, and all of these healthcare practices were approached by a company. I don't know how they got involved with the company, but they were approached by this company who they said made billions to get down with this scheme. What possesses you as a nurse? And listen, let me tell you something. If I get down with the scheme, my practice that I built, hard as nursing is, to work and to build your own practice. Listen, if I get down with the scheme, I ain't gonna be getting no $200 cash.
Word. Is there a lot of fraud that goes on in Medicaid and CHIP?
Here's a hot tip. If you're looking for fraud in Medicaid, people who are enrolled in Medicaid, who are being covered by Medicaid, are the victims and not the perpetrators. It's your little guide to cuts that they're making. If they are cuts that are directed at people, like, for example, the work requirement, which is just going to kick a lot of people off, millions of people, that's not addressing fraud. Here's what fraud looks like. Like, every health care system has fraud. We don't know how much fraud Medicaid has.
That's crazy.
But obviously you have unscrupulous criminal actors who maybe have fake labs charging for services or overbilling, unscrupulous providers. Maybe we have some hackers somewhere, whatever. But people don't get money from Medicaid. They get health care.
Kickbacks, double billing, patients exploited. State and federal investigators accuse New Way of Medicaid fraud. To settle the allegations, the addiction treatment provider is now paying out $18.5 million. This follows multiple investigations by KARE 11, exposing New Way's complex double billing scheme. That reporting, it resulted in a series of legislative reforms. But the Fed's case dates back to 2021. Newly unsealed court records reveal that's when whistleblowers came forward with evidence New Way was lining its pockets by orchestrating a plan to get paid for 4 hours of work in just 2 hours and overprescribing treatment using free housing as a kickback to patients. The feds label it all fraud, and now New Way is paying back millions to settle the allegations while not admitting that they did anything wrong.
The nurse who had their own practice and the nurse who was collecting $200, that I don't know if that was her own practice, but you hustling backwards. I know you're looking at it like, well, you know, I could probably make a lot of these $200, you know, I could do a lot of these right here. You know, I could turn 200 into 100K. No, right there, that's, you're dealing at a micro level right there. You're not going to get to where you want to get to anywhere soon. So you playing yourself, you willing to lose your practice. I mean, I guess that company that was worth billions, you saw they was trying to get down on it, but as soon as you get caught like you did, I'm sure they probably walked away and they have nothing to do with the situation, just you. With that being said, I mean, sometimes you got to think about what really makes sense. Yeah, you getting this cash right now, but on the long run, is it worth your freedom for that amount? I mean, the other lady now, don't get me wrong, the $9 million, I don't know what it is, but they said they gave her like 40 something months sentencing, so that's a little bit over, that's a little over 3 years right there. And if she gets to keep her money, hey, listen, I'm not condoning what she did, right? But if she gets to keep most of her money, then, I mean, that's an even exchange if you ask me. On her part, I wouldn't trade my place with her any day. You understand what I'm saying? But with that being said, listen, people are getting greedy. People with more always want more. And some people can't control their greed and they end up crashing out, making moves and decisions like this just for the sake of having a nice car that is going to be outdated in the next 3 years. So why even go through all of that right there? Just wait your time. You know, be patient. Patience is a virtue. If you're watching this channel, don't forget, like, comment, share, subscribe to the channel. Go in the comments. Let me know your thoughts on this and what kind of video you want to see next. I'll see you in the next one.